Hello, this is Dr. Robert Smith from Chiropractic Whole Health, and I want to talk today about the ketogenic or the keto diet and how it works, when to use it. So the ketogenic diet, or the keto diet for short, is basically a high-fat, low-carb diet. Our bodies mainly use carbohydrates for energy, really to supply our brain with energy. And we can store about 2 days worth of carbs in the form of glycogen in our liver and in our muscles. But we have a backup system. After about 2 days, we burn through all those stores. Our body will shift into a state of ketosis where we're burning stored fat. So we burn up all our carbs, all the glycogen in our body, and we shift into stored fats through our liver to supply our brain. So the ketogenic diet is basically 80% fat, very little carbs, a little protein. The carbs should be less than 30 grams a day. That's about 2/3 of a cup of rice. So earlier this year, let me go back. I have used in the past a number of different diets. I've tried fasting anywhere from 3 to 7 days. I've tried juice fasts. I've tried various detoxes. I've been through the standard process cleanse, I think 6 times. One diet I've not tried is the ketogenic diet. So my diet had really gotten off track over the holidays. I was eating a lot of sugar. I was eating a lot of junk. I was sugar trapped, basically. I was craving carbs. I had gained some weight, and even changing my diet a little bit, I had found the weight just wasn't coming off like it had. And as I was growing a beard earlier this year, my kids like to remind me that there was gray in it, and I was seeing that as a sign of my advancing age. So I wanted to try a different diet. So I went with the keto diet. So really what I was eating was a lot of meat, fish, chicken, bacon, eggs, cheese, heavy cream, nuts, and then a lot of greens, spinach, kale, romaine, spring mix, and some low-carb vegetables. So I learned a few things from it. First thing I learned was that being on a keto diet does subdue hunger. I found that I was eating about 1,200 calories a day, and I really wasn't hungry. It really wasn't bad. I didn't have the cravings that I get when I'm eating a lot of carbs. I didn't have those cravings, and I was getting by fine. The second thing I learned was that I did lose weight on it. I lost weight slower than obviously doing a fast or even doing the standard process cleanse. I found that I lost weight more slowly. It wasn't as dramatic as I was used to. On the downside, a keto diet I think would be hard to comply with for a long period of time, mainly because you get tired of eating what you're eating, which is a lot of fats. You have to be really creative if you're going to do a keto diet. You have to do your research on recipes and really be prepared for it. So those are the things I learned. Overall, there really are 2 reasons I would give a ketogenic diet to a patient or recommend it. The first would be if you're pre-diabetic or diabetic. So if I've done blood work with you and it indicates you are going into diabetes, or maybe you're already diabetic, this could work for you. And I have to say the disclaimer that I'm not giving medical advice here. If you're on medication, the dose may need to be changed. You're going to need to be monitored more closely. So I can do that. Your doctor can do that. The second reason I would give this diet to a patient is if you're basically sugar trapped, if you're carb addicted, you need to break that. You need to go cold turkey, get carbs out of your life. This could work for you. If you're diabetic, really you're giving your body a break. You're giving your pancreas a break from producing insulin. You're burning up your sugar stores. And if you're sugar trapped, really you're just breaking the addiction that has on you. So I'd say for a period of 4 to 6 weeks, this could work for you, and then you could transition into a different diet. Long term, all of these diets I've used over the years, all the patients I've worked with, I've found really the best is either the standard process cleanse or the Whole30, which are really protein and vegetable based diets. I think long term those are easier to sustain, and that's what you would transition into. So if you have questions about the keto diet, ask me. Now I know about it and I can give you more info. So Chiropractic Whole Health. Thanks a lot.